Hello and welcome to another edition of Doctor's Orders. Last week we talked about the symptoms of coronavirus. Hopefully everyone's aware that the main symptoms being fever and cough, and also you're aware about the lesser known symptoms such as fatigue and muscle aches, loss of taste, loss of smell, and gastric symptoms as well. But what I want you to be aware about is something very important, and if you stay tuned, this could potentially save your life. This is where things go a bit worse, and normally this happens in the second week. Most of us are going to have mild symptoms, but in some people, we don't know why, we don't know who it affects and why, but they over-respond to the virus. As a result, they create what's called a cytokine storm, which clogs up your lungs and leads to potentially organ failure as well. Recognizing this is going to be the key to your survival, and it can occur very quickly, a bit like sepsis. Hopefully everyone is aware about sepsis. You could be young and fit, so it can happen to any one of us. So first of all, in the second week, if you still have a temperature, you need to take notice. This could be something you need to speak to the doctor about. So if the fever is ongoing, and on top of that, you may start developing some respiratory symptoms, which could be the beginning of the severe acute respiratory syndrome, which is what coronavirus causes. It could be a sign you've got a pneumonia developing as well. You may need antibiotics as well. Or you could be developing sepsis. Now also you will start to feel out of breath, and you may start feeling some pain in the chest, which we describe as pleuritic. In other words, it's sharp like a needle, and when you breathe in and out, it hurts more. So that's pleuritic pain. But I want people to really focus on the breathlessness, because when the doctor rings you, he's going to ask you these questions. And if you're armed with the information, it will really be helpful. So first of all, think about when you're speaking, when you say a sentence, can you complete it with more than a few words? Or are you stopping midway through your sentence for the breaths? Or at rest, are you breathing harder or faster? Can you no longer do your basic daily activities? And also, how are you today against yesterday? All these questions are going to be vital. The doctor's going to ask you, and you need to be aware and armed with the information. The first thing to do is see what equipment you have lying around the house that can help you. Some people might have a thermometer lying around. This particular one measures it in your ears, but you might even have one that goes under your tongue or one that goes on your forehead. Whatever you have, it's going to be useful to measure your temperature. Next thing some people might have is a blood pressure machine. Again, going to be very useful because it will tell your blood pressure as well as your pulse. Again, very important. Some people might have invested in a pulse oximeter. This measures your oxygen levels as well as your pulse. So again, may not be lying around as standard. Some people might have ordered it from the internet. Again, can be useful information. Next thing is, some people may have a smart watch. So again, these can measure your pulse rate as well and various other parameters. So that's going to be important. Some people might have a blood sugar machine. Again, if your sugars are sky high, that's important information. What about the thing you're actually looking at right now, your phone? Some phones, such as some Samsungs, can check your oxygen level and your pulse level. I believe it's called Samsung Health. Again, very important to utilize that information. And also, if you're an asthmatic, you might have what's called a peak flow machine lying around. So again, that will be very important information. So if you have that, great. If not, don't worry. Let's first of all start off with the basics. How to measure your breathing rate. Again, you might think it's simple. Some people have asked me, when I breathe in and out, is that one or two? And actually, yes, it's one breath. So one expansion is one breath. So when you go out and in, that's one. So you then have to measure how many breaths per minute are you doing. The problem is that when you measure yourself, your breathing changes. So it's better to get somebody who's watching you to do it, maybe while you're not aware that they're watching you doing it, maybe while you're watching television or something. Or you could maybe record yourself and then measure exactly how many breaths per minute. Again, going to be vital, important information. Next thing to do, how to measure your pulse. Again, now what you do is, if you do it on your wrist, the outer aspect where your thumb is, there, that point there, you press your finger or a couple of fingers there hard until you feel the pulsing, so you'll know your pulse rate, and then feel that, or put a few fingers against the side of your neck. Again, you'll feel the pulsing. How many pulses per minute are you doing? Going to be vital information to find out. So now you've got this information. What else are we going to ask you? So I've already asked you about completing sentences. There was a particular test called the Roth score, but we've now gone away from that. But again, you could do in a simple version. You could, for instance, in one breath, say something, or maybe your favorite tune. You could sing it. I prefer, in these current times, Don't Stand So Close to Me, which is quite good, isn't it? So you could try singing that until, how many seconds can you sing that for before you need your next breath? How many words can you get out before you need your next breath? Again, how that changes over time could be more useful rather than just doing it as a one-off. So again, maybe you could consider that. You can also feel your capillaries, which is basically your fingers. So when you basically go against your fingers and press on them until they become white, okay, and then you let go of them, how quickly does it become pink again? Again, that's important, capillary refill, because that will tell us a bit more information if your body is shut down as well. Now, if you didn't have a thermometer, just feel, is your body itself very warm, and versus your hands, are they very cold? Also look for things like, are you having a blue tongue or a blue mouth? That's also going to be very, very important information as well. Now, what are the normal rates of breathing, your pulse and oxygen levels? I'm going to flash that on the screen as it stands there. That's for a normal adult. Again, there are different numbers for children. Do bear that in mind. The other thing I want to mention about children, as well as measuring their breathing rate, if you notice they're in what's called respiratory distress, in other words, they're having to suck in their chest every time they breathe, that's also going to be very important. So hopefully you know some of these things now. You've learned how to measure your breathing rate, your pulse rate. You've learned you can use various equipment, which will all be helpful for the doctor. Also, like I've said at the beginning, tell the doctor what can you do that you couldn't do before, how many words in a sentence can you do, and how are things changing over time. So if you're armed with all this information, this could be the difference between life and death, because then we can act accordingly for you.